Next important topic is what are so interperitoneal organ, they will not ask you question from this, but retroperitoneal organ, you should know all of them. What are the retroperitoneal organ? You should know all of them. So there is a famous mnemonic, I'm sure you guys are all aware about, SAD pucker. So what are the retroperitoneal organ? The mnemonic is SAD pucker. SAD, S is suprarenal gland. Suprarenal gland. A is aorta. D is second portion of the duodenum. P is pancreas, except tail of the pancreas. U is ureter. Colon, and colon will include ascending and descending colon. K is kidney. E is esophagus, thoracic part, and then R is rectum. Now, why retroperitoneal organs are important? Because the problem is if there is an injury to the retroperitoneal organ, the patient can bleed to death. So that's why they are very, very important. So let's say if there is a injury to the kidney, a patient can develop hematoma or bleeding retroperitoneally in the peritoneal space, and they can bleed to death. That's why they are very important. So you need to know all the retroperitoneal organ, because according to the site of surgery, if you know this organ is retroperitoneal, then you can suspect the complication. So from clinical standpoint, they are very important. Next is femoral triangle. Again, they will not ask you about boundaries. They will ask you the content is more important. So femoral triangle boundaries: superior internal ligament, medial adductor longus muscle, lateral sartorius muscle floor is iliopsoas, pectineus, adductor longus muscle, and roof is fascia lata. So you can see this is femoral triangle. So on the lateral side, you can see this is sartorius muscle. The medial side, adductor longus muscle. Look at left, and the superior part is inguinal ligament. And the inside, you can see that pectineus muscle is here. But let's focus on the content. So from lateral to medial side, the mnemonic is navel. N-A-V-E-L. N is nerve. This is the nerve. A is artery. Lateral to medial side. So we are moving in this direction. Laterally, this is lateral. This is medial. Lateral to medial, nerve, artery. V is vein. E is empty space. And L is lymphatics. So the contents are important, lateral to medial side. Next is femoral ring. So again, they will not ask you about the boundaries, but interiorly there is inguinal ligament. Posteriorly, pectineus muscle. Medial is base of the lacunar ligament. Lateral is femoral vein. So femoral ring is located somewhere here. Again, femoral ring is not very important. They will not ask you about that. Femoral hernia is very important. Why? Because there is a high risk of strangulation with this kind of hernia. So femoral hernia is more common in female. Femoral ring is a point of potential weakness of abdominal pelvic wall. So the bowel loop will protrude into the femoral canal and strangulate. It is below and lateral to pubic tubercle. So this is pubic tubercle. and this is below and lateral to pubic tubercle. Why it is important? Because if you compare femoral hernia with inguinal hernia, so inguinal hernia is more medial and superior than femoral hernia. So you can see this is pubic tubercle, pubic symphysis. This is pubic symphysis here. So in terms of femoral hernia, you can see this is below and lateral. This is femoral hernia. Again, more common in female, high risk of incarceration, strangulation. But in case of inguinal hernia, more medial and then more superior compared to femoral hernia. So if they give you all the option that patient has hernia, female patient, the answers are direct. Number 2, indirect. 3 is diaphragmatic hernia. 4th is umbilical hernia. 5th is femoral hernia. And if they give you if the patient is complaining of pain, he's not able to move the gastric content or the herniated content move backward. So femoral hernia is the kind of hernia which has high risk of strangulation. So the answer will be femoral.